Hi, I'm Dr. Steve Grinstead. Welcome to our Freedom from Suffering Now, my how-to vlog series. Today, it's how to develop an effective and safe chronic pain management program, and especially for people who are in recovery from any chemical substance use disorder, alcohol, other drugs, pain meds. So I want to talk about all the pieces that are necessary and how I've been approaching it. I've been working with people with chronic pain and coexisting disorders, including addiction, since 1984. And since 1996, I've been developing my addiction-free pain management treatment system. Recently, over the last few years, you've been seeing a lot come out in the media, a lot come out in research about how there's a prescription drug epidemic, especially for people with chronic pain. It's getting worse. And unfortunately, I'm seeing the pendulum go back the other way. Today I am wanting to share some information that's going to help. And one of the information is practicing good self-care and having fun when you live with chronic pain. I've been living with chronic pain for a long time, over 30 years. And today I'm practicing what I teach. Yesterday I did a training with a room full of healthcare providers on self-care planning and codependency healing for people delivering self-care, healthcare. And one of the commitments I made, because I asked everybody to make commitments, so I did too, was my commitment today was to take some time to chill out and relax and go to the river with my dog. So excuse me just for a minute, because I'm here at the river with my dog and she wants me to throw the ball. So just a minute. Come here. Okay. Go get it. All right, so now she's out in the river. She'll leave me alone for a minute. So when I'm looking and working with people and helping them develop an effective chronic pain management plan, I'm looking at the whole person. So I need to do right up front an assessment. I want to see how well they're functioning in the biological realm, things like diet, nutrition, exercise, hygiene, and stress management. So things like that belong in the physical domain. So I want to see how they're scoring in that area. How high functioning are they? And when I do that, I can take a look at what they need to do differently. Dog's back. Woo! There she goes. Okay, so when I get that down, that's my starting point. So I get to see where they're at, and I want to tell them I want to see an improvement in this by at least 30% in the next 6 to 8 weeks that we're working together. Then we take a look at the psychological area, how well people are managing their thinking and their uncomfortable emotions, how well they're making decisions, how well they're practicing good psychological hygiene. And this is also the area where I want to do an assessment, and this overlaps with the physical, because here's where I want to see how much of their pain is physiological, the ascending pain signal that goes up to the thalamus, and how much it is psychological, emotional. That's what the thalamus does with that information. It sends information to the frontal part of the brain, there's a thinking response, and back to the limbic system, and there's an emotional response. So with that, I can differentiate how much of their pain is physical and how much is psychological, emotional, and then I can start using that data to develop a cognitive behavioral plan for the psychological, emotional symptoms. And when that happens, they can have a chance to move out of suffering. One more time. I have so much fun with this dog. That's part of my way to chill out and relax, and it's very spiritual here too. I'll get to that in a minute. So in the psychological realm, it's really crucial to teach people that they don't have to suffer. A lot of people are in what I call a chronic pain trance, a hopeless, helpless state of being. And they mistakenly believe it's always going to be like this. I'm never going to be functioning again. I'm never going to be able to have a good life. Believe me, I was there. In my early pain rehabilitation, man, I was so much there. I came so close to choosing suicide because I thought my life was over. And over the years, I've worked with a lot of pain patients who were in that place and helped them see there is always hope. So now the next piece we move to is how well are they interacting with friends, family, and community, the social component. And what I found over the years is most people, by the time they get to me, are very isolated. They have pulled away from people. They mistakenly believe they can't have fun anymore, so why bother? They burn out friends, family, and everybody else, and they're kind of living like a hermit. So I want to see where they're at exactly and help hook them up with some social support, how to develop a social plan, how to, say, join a chronic pain support group, like Chronic Pain Anonymous has a great program for people living with chronic pain. So they be with other people who are in the solution rather than living in the suffering and problem. I want to make sure that they develop a list of guides and coaches who they don't have to pay, who can help them on this journey to freedom from suffering. And I give them some strategic cognitive behavioral worksheets and instructions how to find and teach and educate their team on how to better help them. So once we get the social domain nailed down, then we move into the spiritual. Now, I'm not talking about religion here, I'm talking about spiritual. Many people suffering with chronic pain have lost contact with their spiritual values, practices, and principles. And here's where I want to see where they're at and give them some ideas about how to reclaim their spiritual power. I have a whole worksheet on that, reclaiming your spiritual power, where I take them through and educate them about spirituality, difference between religion and spirituality, and what are some common spiritual values, some common spiritual principles, and some common spiritual practices, and then have them develop their own. And then, more importantly, how do they integrate those into their life? How do they manifest those? How do they practice those? And for me, you know, the spiritual component, I find a lot in nature. I find a lot when I'm playing with my dog, when I'm throwing the ball for her, or when we're just chilling out at home. And when she recognizes I'm not in a good place, she'll come up and she'll want to be there with me. Sometimes she'll just lay down at my feet. Other times she'll put her head in my lap. Sometimes she'll whine a little bit because she wants to help me and she doesn't know how. So, you know, the spiritual for me, my dog is one of my spiritual avatars. I mean, she's very, very powerful for me in a healing sense. Coming out here to the river, I'm at the American River in Sacramento right now. The river levels are way up because of all the snow we've had this year, and it's now starting to melt, and so the river level is way, way up from where it normally is. And I'm really enjoying this. I'm enjoying being in nature. And that's what I want to help my patients develop, is how do they get their life back? How do they reclaim their spiritual power? How do they find peace and contentment and move and shift away from suffering? You know, that is what's really important. So those are the components. Now, the other part, when I started developing the addiction-free pain management system, I noticed that there was a syndrome that occurred for people with chronic pain and coexisting disorders. I coined it the addiction pain syndrome. Now, the addiction pain syndrome, how I looked at this was, you know, when I first started doing research in '96, I wanted to find out what happens for pain patients when they go in to get help. And so I started doing a lot of research, and unfortunately I was very frustrated, couldn't find any, so I went out and did my own. And that's when I started noticing this syndrome, the addiction pain syndrome. So what it is about is, you know, people who have an addictive disorder, they have certain side effects or negative consequences because of that. You know, it impacts them biologically, psychologically, socially, and spiritually. Now, when people who are living with chronic pain, they're also impacted in those four areas: biopsychosocial, spiritual. There's a body-mind-spirit connection here. Now, when the same person has both chronic pain and coexisting disorders, including addiction, there's a synergistic effect. 1 + 1 no longer equals 2, it's 3 or more. So it's much more intense. So when the person goes to an addiction treatment program, they're only dealing with 1/3 of the issue. If they go into pain management, they're dealing with a different third of the issue. Now, a lot of programs over the past decade have started dealing with both, you know, and they would find that addiction medicine would refer to pain management, and pain management would refer to addiction medicine. Now we're dealing with 2/3 of the problem, but very few places realize there needs to be an integrated, multidisciplinary team approach with really good communication with everybody on the team, including the patient, who I believe is the captain of the team. So I needed a synergistic treatment solution for a synergistic treatment problem. And that's why I developed addiction-free pain management. The three core components are, the first one is identifying the medical and medication and safe and effective, recovery friendly in some cases, medication that needs to be in place, any medical diagnostics that need to be done, medical procedures that need to be done, what's going on, do they need something, physical therapy, something like that. Then I look at the psychological, emotional, the suffering area. This is where I deal with the cognitive behavioral interventions when I've assessed how much of their pain is physiological versus psychological, emotional. And I want to help them develop a plan to reduce the psychological, emotional. And when they do that, they're amazed to find that their physical symptoms, their perception of their physical symptoms goes way down too. One more time, dog. So I hope you don't mind. Me and Dog here have this ritual, and I don't want to deviate from it with her. But it's very fun. I want you to see me in my habitat, my element, when I'm practicing what I teach. So now when I'm helping people develop that cognitive behavioral plan, it's really important to make it very simple. Meet them where they're at. How to change their thinking, how to identify negative, self-defeating thinking patterns, how to identify any of the 12 core denial patterns or the monkey mind chatter that pop up for people when they're in a pain flare-up, for example, and how to develop healthy emotional management tools and make safe and effective decisions, increase their impulse control to stop doing things that hurt them. Then the third core component of addiction-free pain management is the non-pharmacological or non-medication-based interventions, the holistic interventions. Things like meditation, going to acupuncture, going to physical therapy, hydrotherapy, going for nature walks, walking a labyrinth. There's literally thousands of different things people can do to help them other than medication. So I want them to develop a very proactive, non-pharmacological plan, and especially a strategic, safe, and effective pain flare-up plan. Many people, when they have pain flare-ups, they jump right to the medication. And that's not always a good idea. Sometimes yes, a lot of times no. 90% of the time it could be non-medication-based interventions that work quicker and better. And then the person doesn't run out of their meds and have to get early refills too. A lot of times when I found people, when a pain clinic refers somebody to me because they keep running out of meds early, I will want to help find out what was going on. One of the questions I ask, when you take your medication, how long does it take before it starts kicking in? And a lot of people will say, well, about 10-15 minutes. And then that tells me right there that it's not the medication. So I need to educate them in a non-blaming, non-shaming way and explain that, medication takes anywhere from 45, 50 up to 75 minutes to metabolize enough to start working effectively. And it wasn't the medication, it was you. You did it. And that is very exciting because we do have a lot of control over suffering. We're not going to change that original pain generator signal that goes up to the thalamus, but we absolutely have a lot of control over what our brain does with that signal. And that's what I want to teach people. So the pain flare-up plan is very, very important. And I want to teach them all the types. I'll give them a checklist with at least 50 different non-medication based things they can do and have them pick 3 or 4. A lot of them want to do more. I said, no, we're going to start with 3 or 4. Then you're going to practice these, and some of them require practice when they're in a good place, when they're not in a flare-up, so that when they have a flare-up, it becomes automatic to implement it. So that's the 3 core components of addiction-free pain management. And my goal here is to improve people's quality of life and level of functioning biologically, psychologically, socially, and spiritually, and help them reclaim their life. I want them to move beyond surviving with chronic pain and into thriving despite chronic pain. And it is possible. So thank you for joining me on this how-to vlog on how to develop effective chronic pain management plans, especially for people who are in recovery or maybe need to be in recovery from a substance use disorder. Thank you, and if you have ideas for future topics, I would really appreciate your input, and I look forward to talking to you soon. And now it's time for me to get back to this beautiful Sacramento River and play with the dog. So it's going to be a really wonderful day. So thank you very much for joining me today. Onward and upward. That's what it's about. Onward and upward. We never stay still.